So, good day everyone. Today we'll delve into the molecular underpinnings and advanced therapeutics of carcinoid syndrome. This will build on your existing knowledge about carcinoid tumors and help you understand the intricacies of this syndrome. So, in order for us to understand it, we need to first understand what are carcinoid tumors. So, carcinoid tumors are actually a type of neuroendocrine tumor that predominantly occurs in the digestive tract and or lungs. They are generally slow growing but can metastasize to other parts of the body. Most carcinoid tumors are actually asymptomatic and often found during unrelated medical procedures. The exact cause of carcinoid tumors remain unknown, but certain genetic conditions and environmental factors may increase the risk. Conditions such as multiple endocrine neoplasia 1 or neurofibromatosis type 1, the old von Recklinghausen syndrome, can predispose individuals to neuroendocrine tumors, including carcinoid tumors. So, what then is carcinoid syndrome? Well, it is a paraneoplastic syndrome that occurs when carcinoid tumors, typically that originate in the midgut, metastasize to the liver. These metastatic tumors secrete various bioactive amines and peptides into the systemic circulation, with serotonin being the major contributor to the syndrome. So, the excess serotonin by these tumors that are secreted cause distinct symptoms such as flushing, diarrhea, bronchospasm, and over time fibrosis. This especially involving the heart valves and mesentery. Remember, when it involves the heart valves, it's typically the tricuspid valve that's most involved, resulting in a tricuspid stenosis. Also note that other hormones may be involved, like histamine, bradykinins, and tachykinins. So one must understand that serotonin is synthesized from tryptophan, and elevated serotonin leads to an increase in urinary 5-hydroxyindole acetic acid, which is a breakdown product of serotonin and serves as a key biochemical marker in the diagnosis of carcinoid tumors and carcinoid syndromes. Chromogranin A protein secreted together with the serotonin, is another valuable marker. How do these patients with carcinoid syndrome present? These patients actually present with a diverse range of symptoms and signs, and this is purely because of the multiplicity of hormones that are involved. The most common symptoms, as I mentioned, are cutaneous flushing and diarrhea. And over time, carcinoid disease can develop, affecting primarily the right side of the heart. How do we make the diagnosis of carcinoid tumors or syndromes? It's made on clinical signs, biochemical markers like your 5-HIAA and your chromogranin levels, together with imaging studies. Somatostatin receptor scintigraphy, like your octreoscan, is particularly useful in these patients due to the high expression of these receptors on carcinoid cells. The attached picture is an excellent example demonstrating disseminated carcinoid tumor to the liver, where you have these multiple carcinoid deposits. This is in keeping with the patient with a carcinoid syndrome. So, how do we treat these patients? Well, symptom control is important. The first line of therapy is typically with somatostatin analogs, either with short-acting somatostatin analogs like your octreotide or your long-acting like your lanreotide, which then can suppress hormone secretions. So they can control symptoms effectively in the majority of patients. But surgical resection remains the only curative approach. For metastatic disease, several options are available, including hepatic artery embolization and peptide receptor radionuclide therapy, as indicated in your picture here, or to the right of the slide, and targeted therapy like everolimus and sunitinib, which is a tyrosine kinase inhibitor. So, how do we progress for future? Well, emerging research is focused on understanding the genetic basis of these tumors and developing more specific targeted therapies. Promising areas include inhibitors of the mTOR pathway, anti-angiogenic agents, and immunotherapy. So, in conclusion, while carcinoid tumors and the subsequent syndrome are relatively rare, they present unique challenges due to their slow growth rate, diverse symptom profile, and complex hormonal interactions. Early detection, appropriate therapy, and supportive care are key to managing this disease. And remember, carcinoid syndrome is a complex and challenging condition requiring an integrated, multidisciplinary approach for optimal patient care. Future research promises new insights and better treatment options.